Hi, I'm Karina, and today we're going to talk about the digestive system. The digestive system, and then we're going to go into a disease related to the system, and it's going to be appendicitis. So, the digestive system is made up of the mouth. It starts there, and when you chew, your food gets digested and broken down mechanically and goes down the esophagus, into the stomach, right there, into the stomach. In the stomach, food is digested and is turned into chyme. In the stomach releases hydrochloric acid and pepsin, which digest protein. But then, chyme then gets transported into the small intestine, and that's where everything is digested. Also, the liver produces bile, which breaks down fat, and the pancreas also secretes other enzymes which helps digest food. The small intestine is also where food is absorbed into the body, and the small intestine is also the place where the digested food is absorbed into the rest of the body. The small intestine, The small intestine is also where the nutrients are absorbed into the body, as the small intestine is made up of small villi, which increase the surface area. Then, it goes into the large intestine, which starts about here, and it goes a loop around the stomach and comes down right here. The large intestine is where water and other electrolytes are reabsorbed into the body. Waste is then stored in the rectum until it is ready to be passed out through the anus. Okay. The appendix is a smaller projection at the beginning of the large intestine and is made partially of lymphatic tissue, and until now has known no bodily function. The appendix secretes mucus and travels through the appendiceal lumen into the large intestine. Appendicitis is usually the result of the appendiceal lumen being obstructed. When the appendiceal lumen is blocked, the mucus cannot pass into the large intestine and thus flows back into the appendix. Bacteria then multiply and cause the appendix to become inflamed. There are several reasons for the blockage: enlarged lymph tissue, growth of parasites or feces, or an inflammatory disease such as Crohn's disease. Symptoms of appendicitis may vary, but most common are sharp pain and tenderness in the lower right abdomen that can increase over time, nausea, vomiting, loss of appetite, and the inability to pass gas. If appendicitis is not treated in time, the appendix can eventually burst, and the contents of the large intestine can enter the abdomen, causing a dangerous widespread infection, also known as peritonitis. Appendicitis is usually treated by a surgical process called appendectomy, which is the removal of the appendix. The earlier the surgery, the less likely the appendix will rupture. Sometimes other complications, such as the presence of an abscess, may prolong the seizure.